You hear it all the time. 70% of Americans want Medicare for all. People with a universal healthcare system have higher standards of living. You're racist because you don't want to pay for shit that you don't think you need. All of this is really quite annoying, but one point that the left makes over and over and over again needs to be refuted. It's the quality of care metric. By saying that countries with a universal healthcare system have a higher, quote, quality of care, they claim that they are on the moral high ground. What is the best metric for measuring quality of service? Is it simply asking, hey, do you like your service? Not really. Why? Because if the only service available to you is what you know, of course you're going to like it. The same logic can be presented like this. Hey, do you like the air that you're breathing? The only response is yes, because it's the only air you'll ever know and you've ever known, meaning you'll never know that there's better air elsewhere in the world. If you say no, you're either stuck in the shitty air, or, as in the case of the United States with a market system, you go get better air. The government has no control of where you live and where you breathe, just like they have no control of who you see and where you see a provider for your medical care. It's not an exact comparison, but it's viable. To say that either statement is untrue or absurd is to intentionally ignore an argument because you have no counter to it, which is fine. I'm used to that from leftists. The following data has been taken from two non-United States sources. First, a 2016 survey done by the Canadian Institute of Health with over 4,500 respondents from 11 different countries, including the United States, Sweden, Denmark, Canada, UK, Norway, and more. The other study was published in Health Policy, Volume 112, Issues 1 through 2. Links will be provided at the end of the video and in the description below. In the survey by the CIH, there were 57 tables of data, and I'll be referencing the United States and a few choice countries that we like to lump into these discussions, such as, but not limited to, Sweden, Denmark, Canada, UK, and Norway. Not the entire list, just a few choice ones that are always brought up when discussing universal health insurance. First off, the fundamental overhaul and change of our health insurance system that would be Medicare for all is by far the most expensive idea that the fascist left has brought up to date. It's important to make the distinction between healthcare and health insurance. Leftists say healthcare when they're talking about health insurance. The left wants the government to act as the payment body between provider and patient instead of a private company. Very important to note. Democrats don't care about healthcare, specifically yours. They care about health insurance. This complete overhaul, according to the study, is only supported by 22.9% of US respondents. Everywhere else, they think their care is fine. Again, because they don't know about better care. In the United States, for instance, for an elective surgery, the normal wait is 24 days. According to the study I referenced earlier from Health Policy Volume 112, Issues 1 through 2, the average wait time for an elective surgery in 15 universal healthcare countries is only matching the United States one time, by Scotland. Here are the other wait times for the countries I mentioned before that I would bring up. Again, these countries are often brought up when talking about Medicare for all or a universal healthcare system. Sweden, 31 to 60 days. Denmark, 38 days. Canada does not record these times. UK, 35 days. And beloved Norway, 75 days. I gave these countries the benefit of the doubt when reading this study and thought maybe because these surgeries are, quote, elective, that the wait times are that long because they're not a, required surgery. But the numbers only get worse for the most part. The study also looked at cataract surgery. Again, in the same order listed above. Sweden, 31 to 60 days. Denmark, 112 days. Bernie's beloved Denmark. 112 days for cataract surgery. Canada, 2 to 88. That's the span. 2 to 88. UK, 18. Respectable. Better than the United States, as a matter of fact. And Norway does not record the statistics for cataract surgery. Also given are the times for Australia, Ireland, and Spain at 84, 90, and 60 days respectively. Not normally countries brought up when talking about a universal healthcare system. However, these countries have a much heavier influence on socialized medicine than the United States currently does. Want to know the wait time in the US? It's 24. Again, only touched by one. And beaten, as a matter of fact, England. But it's not consistent. Clearly, each statistic has an outlier. Yet Scotland in the first example, England this example. Let's go to a third example. And a final surgery. Hip replacements. Poor little grandma. The US, again, treats this as an elective surgery. So, for the elective surgery of hip replacements in the United States, the average would be 24 days. Sweden, 31 to 60 days. Denmark, 58 days. The UK, 78 days. And Canada, 42 to 172. You heard that right. 172. I get it. That is the worst possible scenario, and that is not the norm. But neither is 42. Falling somewhere between a month and a half and 6 months for a hip replacement. That is depressing. Poor little grandma may not even last that long. Now, obviously, that's a little bit of fear-mongering. But in all reality, 42 to 172 days in Canada. Look how great Canada is. Look how great Denmark is. Look how great socialism is. Socialized medicine. It's crap. So when you say that countries with a Medicare for All program have better care, that's just not factually true. And there's two ways of going about finding out how genuine of a person you are. You either don't know these statistics and claim this because you've been duped and you can learn. Or you know the statistics. You know the reality. Yet you continue to lie and you don't care. Because you think that when push comes to shove and bullets are being put in brain cells, your head will be spared. Because you were part of the resistance. When asked about the most recent time folks had to wait for care in the emergency room, here's how the US stacks up against other countries. It doesn't go any further down than before 1 hour, and most of the numbers are pretty consistent above 50%, except for UK, Norway, Germany, and Canada. For 1 to 4 hours, the real outliers are UK, Germany, and France, all above 30 or so percentage points. Germany being the only significant diversion of over 50% saying that they've had to wait between 1 and 4 hours. The over 4 hour statistic really only shows two horrific statements of ineptitude in this survey. Canada boasts a whopping 29.5% of their respondents, and Norway with 20%. Nearly 1/3 of respondents from Canada are waiting more than 4 hours in the emergency room. Other than that, everything is anywhere from 1 to 13%. I know recently Rand Paul just went for his health care in Canada, but he didn't go there for the overall great general care and emergency room stats. He went for a specialist known for their work. This is completely different from subjecting an entire population to doctors funded only by government. Thank God for FedEx and UPS, because the USPS is bullshit. According to the CIH survey, the US is the only country where respondents said over 60% had them waiting less than 1 month before seeing a surgeon after being recommended for surgery. They're the only ones. The next 6 questions of the survey refer to people missing out on services because of cost. This is why it's important that we make very clear why we distinguish between health care and health insurance. People want affordable health insurance, not better access to health care. Everyone born in this country has the same access to health care as each other. Everyone has equal access to obtain insurance in this country. Not everyone chooses to buy it, and not all people mostly from their own bad decisions, can afford to buy it. By forcing someone who can afford something into buying it when they don't want to is encouraging fascism. But I'm sure you're already well aware of that. Most of the remaining questions have to deal with general knowledge of the care being provided. And there's no real statistical outlier, but it is worth noting that the United States leads in stress causes, quitting smoking, overall nutrition, and physical activity information exchange from the provider to the patient. In other words, our providers, on average, tell our patients that you need to eat better, you need to quit smoking, you need to reduce stress, you need to exercise, on average, more than the people that the government are forcing you to see in their universal healthcare system. It's not statistically noteworthy, but it is worth mentioning. Overall, you can take a look at the information given, but if you do, and you honestly take a look at the numbers, you'll see that the USA leads in many key categories. This isn't just from one study, or even those darn right-wing sources. Independent and international sources doing work and gathering information through credible means with a healthy sample size. I'm not sitting here saying that the care is worse in all of these countries because of socialized medicine, but I am sitting here saying that the care is better here in the United States, and the statistics show that. To say that the care in other countries, because of socialized medicine, is better is intentionally misleading after you've seen the information. It's also worth noting that from another source, ProPublica, the level of care is measured here by state in the USA. Just for shits and gigs. The worst 5 states with the worst waiting times in the emergency room, where people really need help. These are emergency rooms. They're leftist states and cities. DC, Maryland, Delaware, Massachusetts, Vermont. The best 5 are comprised mostly of red states, Colorado being the outlier here. The others being Utah, South Dakota, Montana, and Wyoming. Link in the description below. Democrats have no idea how to run anything, least of all, healthcare. Leftist policies lead to terrible care in Canada, Norway, Denmark, and leftist states like Maryland, Delaware, Mass, Vermont, and the District of Columbia. This is why socialized medicine is not a good idea, because the people who want it can't run the they have now as well as we do with the market system. Bottom line, government is bad at running shit. Private enterprises who have a passion enough to sacrifice their hard-earned money and days, hours, nights from their families to start a business, to provide a service, will always run things better than government, who just attempts to take more from the haves and give it to the have-nots, claiming that they have the moral high ground. Thank you for watching. I hope you guys enjoyed this video. If you want to see more of these, I can't guarantee a schedule. I'm very passionate about these subjects. The ones that I will choose to take on are ones that mean a lot to me. So, again, I'd like to do these in the future. So, anybody watching this at all, I very much appreciate it.